Hi, I'm Dr. Fred Echols, Acting Director of Health for the City of St. Louis. This week, the Department of Health received several questions related to the importance of vaccines and vaccinations. Jessica from zip code 63118 asks, why are vaccinations important? It is always better to prevent an illness rather than treat it after it occurs. Vaccines are one of the safest ways to help prevent many infectious diseases. We should all speak to our healthcare provider about the COVID-19 vaccines. Over the years, vaccines have prevented many disease outbreaks and saved millions of lives. Vaccines have made many diseases rare. Illnesses including polio, measles, diphtheria, whooping cough, rubella, mumps, and tetanus can now be prevented by vaccinations. Vaccines work with your body's natural defenses to help you safely develop immunity to disease. Immunity to a disease is achieved when there are antibodies to that disease in a person's system. Antibodies are proteins produced by the body to neutralize or destroy toxins or disease-carrying organisms. Antibodies are disease-specific and lower your chances of getting certain diseases and suffering from their complications. Carol from zip code 63115 asks, what would happen if we stopped vaccinating? That's a great question. Vaccines have greatly reduced and in some cases eliminated numerous infectious diseases that routinely killed or harmed individuals. However, the viruses and bacteria that cause these diseases still exist, and you can still get these diseases if you are not vaccinated. Discontinuing vaccinations will lead to diseases currently under control, staging comebacks resulting in infectious disease epidemics and more individuals dying. Darnell from zip code 63120 asks, I'm young, healthy, and in good health. Why should I get vaccinated? We do not vaccinate just to protect ourselves. We also vaccinate to protect others, including our children, grandchildren, and their grandchildren. Vaccinations are one of the best ways to put an end to the serious effects of certain diseases. A not so distant example of this is smallpox. Vaccinations helped eradicate this disease from the general public, and it no longer exists outside the laboratory. Smallpox is now only a memory, and if we keep vaccinating against other diseases, the same may someday become true for them too. I want to thank Jessica, Carol, and Darnell for submitting questions, and all of you for tuning in. Be sure to tune in next week for more critical public health information. I want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well, St. Louis.